Good evening to all. Today's 32nd medical term is called as pseudophakia. Generally, the word pseudo refers to false, isn't it? So, what is exactly false here? Well, an artificial intralocular or intraocular lens instead of a natural lens. I mean, this is something that we generally do during or after cataract surgery, isn't it? But the problem is here, this condition is, or it happens after replacing the natural lens with an artificial lens, and the replaced lens causes this. So it's not an eye disease, it's a post surgical state where the lens was not an appropriate lens, which has been uh, inserted into the patients, and due to that, this particular condition arises. But it's not the same as aphakia, that is the absence of lens. Okay, so keep that in mind. It's a functional replacement to restore the vision. So the purpose of adding the lens was good, but unfortunately, the maybe the quality of the lens or the procedure of the lens insertion could have gone wrong, and due to that, this particular pseudophakia condition arises. So, how can we correct this problem? Well, the implications are sort of four types, that is, vision correction, residual refractive errors, and there are some potential challenges as well as possible complications. So, vision correction, obviously, when the lens is wrong, I mean, it can really affect the vision. So, probably, I mean, the purpose of introducing artificial intraocular lens is to correct the vision problem and therefore to reduce the need for glasses. Sometimes after surgery, some may require glasses or lenses to correct any remaining refractive errors, which is known as astigmatism. That is why we introduce this. Or there can be some, it can complicate eye examinations, like especially vision assessment or even retinoscopy. And sometimes this can even lead to infections, inflammation, right? Retinal detachment. So pseudophakia is not an eye disease, but it is a false lens, a post-surgical state that had occurred uh, because of replacing this natural lens with an artificial intralocular lens. And generally, it happens as a post-surgical procedure. Thank you.